Hi, my name is Dr. Howard Glazer, and I would like to tell you about the role of pelvic floor muscles in sexual performance and pleasure. Pelvic floor muscles, as the name suggests, are a group of muscles lying in the floor of the pelvis, slung like a hammock from the pubic bone in the front to the coccyx or tailbone in the back. These muscles perform bowel and bladder control, support of pelvic organs, and sexual functions. They were first studied by Dr. Arnold Kegel in the 1940s and 50s. The role of the pelvic floor muscles in both male and female sexual response and pleasure remains poorly understood. My work aims at better understanding of this field by using a simple, painless, but highly sophisticated procedure to measure the activity of the pelvic floor muscles and teach people to control them by actually seeing and hearing their muscle activity, an experience known as biofeedback. This technology is much more sophisticated than the intravaginal and intraanal balloon used by Dr. Kegel to provide feedback of the pelvic floor muscles to his patients. Intravaginal and intraanal electromyography is an objective, valid, and reliable measure of pelvic floor functioning. A literature search of the National Institute of Health Medical Journal Library for pelvic floor muscle biofeedback in the treatment of sexual disorders yielded a total of only 9 papers in the past 25 years, of which 4 were research reports and the remaining 5 were reviews of the literature regarding other functions such as bowel bladder control and pelvic support. In women, studies showed that the muscles attached to the clitoral hood are crucial for adequate genital arousal and attainment of orgasm. Deconditioning or disuse of this muscle results in insufficient activity necessary for blood flow and vaginal friction, and inhibits orgasmic potential during sexual activity. Sexual response and pleasure is enhanced for both partners by genital responses produced by contractions of the pelvic floor muscles. Therefore, the pelvic floor muscle rehabilitation program improves sexual function and pleasure for both yourself and your partner. There are too few studies to reach the highest scientific standards of proof, but there are results of randomized controlled studies in which pelvic floor muscle training has been demonstrated to improve quality of life and sexual functioning in women with urinary stress incontinence. In a Turkish study, improvement in sexual desire and performance during intercourse and achievement of orgasm were reported in women who received pelvic floor muscle rehabilitation.